Hi, my name is Jordyn Halm. I am a labor and delivery nurse at Halm Memorial Hospital. I've been a nurse for a little over 3 years, 3.5 years. I am currently getting my bachelor's degree through McKendree University, and I am in a community health, population health class, and we were assigned to do a project with community health. My project and presentation was a diabetes health fair at Halm Memorial Hospital. I was in charge of doing the A1Cs at the hospital, and so I took that opportunity to focus on A1Cs, dealing with diabetes, and educating those in the community about diabetes. Like I said, this took place at a health fair. We had numerous A1C stations set out, and then I made this poster. So most people get an A1C because their doctor tells them that they need to get an A1C. However, they're not really sure what it even is. So my poster was sitting up in the corner. We also had different demonstrations, different props out, this representing our red blood cell and a normal person's blood sugars as opposed to someone who has diabetes. Some of the people in the community really do well with hands-on props like this. You kind of have to assess their health literacy and see what works best for them. Some people are visual learners, etc. So my poster was set up in the room that we were doing the A1Cs. We had over 100 people come through and get A1Cs at the diabetes fair. So whenever you get an A1C, you have a 3-minute waiting time. It's a simple little blood test, but it does take 3 minutes to run, so that's a great opportunity for education. So those waiting in line to get their A1C were able to view my poster, ask questions, and then every person that came through my line for an A1C was a great opportunity to educate them and see exactly what they knew about the A1C test and their diabetes. Whenever there was slower time, I was able to present my project to groups of people at a time and kind of assess before and after knowledge of A1Cs after my presentation. So here's my presentation. First board is what is an A1C. So the A1C is a blood glucose test, which measures the average blood glucose levels over the past 2 to 3 months. So that's something that I found in the literature review, why A1Cs are being pushed for instead of single blood glucose sugars, and why A1Cs are recommended for a point of care testing in the hospitals as opposed to a blood glucose, because they give a better idea of the span of how people are doing over a month, 2 to 3 month period. Instead of, oh, they were having a bad day, this is their blood sugar, it really shows you how they're managing their diabetes over a period of time. So that is important to explain to people. That's why the A1C is so important. So your results are reported to you as a percentage. Here I have percentages that correlate along with average blood sugars over the past 2 to 3 months. So that was another thing that I found while educating people through the A1Cs, is that they knew that they had this random percentage assigned to them, but they weren't really sure exactly what that meant. So I was able to get their percentage kind of correlate with what their average blood sugars run. The American Diabetes Association really recommends that an A1C is less than 7. That's our goal, is to get you down below 7. So then we went on to educate further, why do you need to lower your A1C? So reducing your A1C even by 1% can decrease diabetes-related complications, heart attack, stroke, foot ulcers, vision, kidney issues, the list goes on and on. So it's also important, we just tell people over and over and over again, you need to lower your A1C, you need to work on your diabetes. If they don't really know the complications that are associated with diabetes, they might not be that inclined to change their habits. So over here, we have, how can I lower my A1C? So to be honest, this is probably the most important part of my education throughout my whole presentation of the diabetes fair. It was really important to assess the health literacy of everybody coming through. You can tell whenever you're talking to someone, if there's someone who goes to the gym every single day, who is active and works out, you're going to be able to tell those people that they can have a higher exercise level, as opposed to someone who you can tell maybe just taking the stairs instead of the elevator or mowing their grass would be extraneous exercise for them, and that's something that they can work to improve on. So we have, most importantly, following up with a primary care provider. You're supposed to get A1Cs done like every 3 to 6 months. If you do have diabetes, follow whatever your primary care provider instructs you. Checking and recording blood sugars. It's important to figure out your habits when your blood sugars are peaking, when they're dropping. So recording and regularly checking your blood sugars is very important. Exercising and being active, and healthy eating and portion control. So a big part of the diabetes fair is we were able to ask people, what is an A1C? What do you know about an A1C? Most of them they knew it was a blood test, they knew it had to do with diabetes. A lot of them were misinformed. They were worried that they didn't fast that morning. That doesn't matter. We were able to educate about that, get their percentages. We were able to, celebrate those who had lowered their A1C percentages, maybe 1% from the last time that they were there. But most importantly, for those that were higher than 7%, some of which were not expecting that number, we did have our diabetes educator was on site. She was able to sit down and meet with people. We had a chef, our licensed dietitian, physical therapy for exercise ideas. We had a whole group of people lined up. The wound center was open. People were allowed that have had foot problems before in really high numbers. We were allowed to take them to the wound center and kind of explain to them, could be where you end up. So whenever we had that 3 minutes while we were waiting for each result, and we're really able to discuss each person's diabetes individually, their medications that they're on, what they need to work on with their diet and exercise. Whenever we would get their percentages, our goal would be to compare it to their previous result, and if it was lower, like I said, that was great. We need to keep doing what we're doing. If not, always room for improvement. Our goal being for our intervention plan that those who came to the diabetes fair and got their percentage, by the time that they came to their next diabetes fair, 6 months or so down the road, that their percentages would be lowered by 1%. That's the kind of goal we're shooting for. Like a 7% weight loss can usually kind of get you down a point. Really keeping that diet in check, and like I said, increasing those, the exercise, medications, primary care provider. Alt Memorial offers diabetic classes, diabetes support groups. We had diabetic foot educators present at the fair to help people get the right shoes, to help with feet care. So the fair was great. Like I said, there was over 100 people that passed through. Lots of opportunities for education. As far as my project went, what worked well and what didn't. So what worked well is that my A1C my posters were stationed while people were waiting in line, and what also worked well was that 3-minute window really let me have time to educate and assess each person individually. We, like I said, had props out. People were able to ask questions, and we had lots of resources available. What I learned most about through this whole process is really the different educational levels in the community and how important it is to figure out different educational styles, and what's going to work for some people is not going to work for other people. Things that I would change if I did this presentation again were that looking at this whole 8 weeks for this class, we found pretty quickly in the first week and a half or so, Lisa James was a diabetic educator for Alt Memorial, and she was my preceptor, and we kind of sat down and looked at both of our schedules, and we thought that the diabetes fair would be a great opportunity for me to do my project. However, it was pretty early on in the class. I wish I would have had a little bit more time to kind of prepare and have more educational opportunities available. Another thing that I would have done differently is have someone there specifically to video my interactions with the people coming through the fair. I talked to a ton of people that day. I presented my poster to multiple people. Getting all of those on video did not turn out as well as what I had planned. The fair was so busy. There were so many people coming in and out. It was really hard to have the time to stop someone. We were all running our A1C stations. I probably would not put myself in charge of an A1C station next time and just focus on presenting to those in the line. Another thing is that I used my cell phone to videotape this project, and I did not know this at the time, but during a great interaction with a gestational diabetic, which really applies to my area, she was one of my best interactions that I had throughout the whole fair. My phone was making a horrible buzzing noise the whole time that I was interacting with her, and so half of my video is very skewed and is very annoying to listen to. So I would make sure that I had my video equipment correct next time. I absolutely loved my experience with this class. I work in labor and delivery. I started in labor and delivery as a new grad, and while I love my area, I feel very excluded from the rest of healthcare. I feel like I can honestly say that I knew nothing about diabetes before I went into this, just very little about gestationals when they come every once in a while. Not only do I feel like I have a much better understanding of diabetes, I brought my knowledge to my floor, my OB nurses. I've been able to ask them, you know, what do you think about this? What do you know about your A1C? Have you had an A1C done? This class is that while learning to do an A1C, which I had never done before, I actually discovered that my A1C personally is a little bit high. I've never gotten tested or had any diabetes that I know of in my family or anything, but I actually fall into the pre-diabetes category, so that was a little wake up. I actually learned a lot about my diet and exercise through the classes that I attended throughout this whole thing. I attended support groups, I attended diabetes educational classes, and I really learned a lot. This class actually changed my practice because I was actually invited to be a part of the diabetes committee here at Alton Memorial Hospital to represent OB in that committee, which I was excited to say yes to. I still feel like I have a lot to learn about diabetes, but more importantly, I feel like I can take away from this class the need for community health education that we have in this area. All of the people that came through the fair came through at their own will. No one forced them to be there. The need in the community, people in our community, they want to get better. They want you to educate them. I think that there's a huge need for that and huge need for improvement. If we can get these people well outside of the hospital, if we can see them at fairs and at support groups and at counseling sessions, that was part of my literature review also, was supporting the, how important group therapy and education and all the different learning methods that have worked for diabetes education. If we can get all that out there, then we can hopefully prevent some of these complications associated with diabetes and lower these A1Cs. And also importantly, a big part of my fair was that not everyone who came through was a diabetic. There were some who diabetes runs in their families, or they were their support person and they wanted their A1Cs done and they fell into pre-diabetes categories, or they were doing fine, and then we would encourage them to keep doing what they were doing. So overall, this was a great experience for me. I actually have been invited to come back to the next diabetes fair and help run the A1Cs, and I'm anxious to see some of the faces that we did A1Cs. If their scores have been lowered, we'll kind of reassess there. But like I said, overall, I enjoyed my class. I feel like I learned a lot, and I feel like the health fair was a great experience for me, and we really were able to reach out to a lot of those in the community. So thank you for listening.